I now look at the Cornwall Regional Hospital, Mr. Speaker, very briefly. The decision to close or not to close any major hospital is a difficult one. Such is the case with the Cornwall Regional Hospital. The crisis at Cornwall Regional Hospital is fresh in the minds of the nation and has shocked the western end of the island in relation to healthcare delivery. The impact of Cornwall Regional closure was highlighted 2 weeks ago when the explosion at Rio Hotel in Montego Bay occurred. Cornwall Regional could not accommodate any of the injured worker, and they had to be airlifted to Kingston. The scattered service we now have has had a significant negative impact on the healthcare in Western Jamaica. As I speak, the services at the usually accessible Cornwall Regional Hospital is spread over 7 different locations. All this while we still have about 200 patients on the wards, 5th floor, 4th floor, and 6th floor. These are areas that we had rehabilitated in 2015. We must acknowledge and commend the workers at Cornwall Regional and their unions for their staunch defense at the onset of the crisis. Had it not been for them, the crisis would not have been taken seriously. They were told it was all in their minds. Now diagnostic services, for example, have been impacted severely, and the blunt reality is that the burden has fallen on the people of Western Jamaica, who will have to pay for these services. Directly linked to this, Mr. Speaker, is the fallout in surgical services and teaching services, as Cornwall is a major teaching hospital. Initially, the Minister announced that the shortfall for surgery would be taken up by UII, already burdened, and we understand that. Couldn't be taken up. The Minister has now stated that Falmouth will take us all the burden. And we hear now that 2 of the operating theatres at Falmouth are now open. Many people with the need for life-saving surgeries have seen their surgeries pushed back with the possibility of death due to the fallout at Cornwall Regional. I urge the Minister again to continue to update the country and especially Western Jamaica on the progress at Cornwall Regional. The opposition recommits itself to working with the government in ensuring that Cornwall Regional is returned to full operations, and will continue with our monthly meetings with the Ministry of Health and the Minister to ensure that the interests of the people of Western Region is protected. There is an arrangement with UNOPS, team from the United Nations. To date, we are yet to hear what is the cost of that engagement. The country needs to be told. The opposition will be closely monitoring the expenditure at Cornwall Regional against the backdrop of the $3.8 billion that will be taken from the NHF.